Hello again, and welcome to another episode of RN Cliff Notes. So this is the part 2, as we were talking about therapeutic drug levels. So what are we doing? Helping students to see through larger concepts, and let's jump right in. Okay, so I'm Cliff Davis, registered nurse, master's prepared, Associate Dean of Nursing and longtime advanced medical surgical nursing professor. All right, as I said, therapeutic drug levels, part 2 of a 3-part series. All righty, and let's get right in. So the 3 that we're looking at this time, utilizing our study smart strategies. Don't forget, studying smart, right? Okay, so we're doing quinidine this time. Carbamazepine, which might look a little different to some people, Tegretol, gentamicin, and those values, quinidine 2 to 5, carbamazepine 4 to 12, and gentamicin 5 to 10. All right, studying smart. Here we go. So, quinidine. If you saw the previous video, we know the moment we see die, what are we thinking? 2. And how does this start out? This range starts out with 2. Never mind, they're kind of in different locations. 5 before the 2. We know that the range would be 2, starting out at 2. There we are. So 2, die, or dice. And then we have quin. So let's think of, when have we heard quin? Well, we've heard of quin when we've heard of quintuplets, for example, right? Yes, absolutely. Let's get some of them in there. And there they are. Okay, so quin, as in quintuplets, we've got 5, and we've also got 2. So what's the range for quinidine? 2 to 5. All right, studying smart, here we go. Next up, we've got carbamazepine, or as we said, Tegretol. So another way of referring to Tegretol, which we hear about a lot, right? Okay, so in this instance, we're going to do something a little bit different. So prep your mind, all right? Here we go. So we're highlighting those letter A's in there, and this is what we're doing with it. Let's bring this down some. Notice on this that I have shaved off the lower part of the capital letter A, and that makes that letter A look like the number 4. Yeah? Look like the number 4. And take that a step further. We'll pull that down some more. And here we've got our math that we want to look at. Right? If we take those letter A's in there and we use that little study smart trick right there, what do we got? 4 plus 4 is 8, plus another 4 is what? 12. Absolutely. And what's the range? 4 to 12 for carbamazepine, or also known as Tegretol. 4 to 12. Okay, let's try another one out. And we got, this time, we got gentamicin. Okay, so now, as you see on the board, gentamicin, genta, right, and mycin. We want to treat that mycin like it's a last name. We've got tobramycin, all these different things, right? So mycin is like a last name for antibiotics. And first name, what? Genta. So how many letters in that? 1, 2, 3, 4, 5. And then in the last name, mycin, 1, 2, 3, 4, 5. So 5 plus the other 5 gives you the range of 5 to 10. In addition to that, just to, give you another way of looking at it as well. I'm a bit old school when it comes to some things. And here we go, right? What does a gentleman do, right? What does a gentleman do? Hold the door. And the true way to get that is to, get the door with all 5 of those fingers, and use the other 5 fingers to what? All right? Highlight the pathway for the nice lady to go through. So, gentamicin, 5 to 10. Absolutely. So, the end of this second part of the 3-part series, And thank you again, and we'll see you in the next episode, okay? All right, study smart, guys.